Come along with me to tour a local trauma department in Cleveland, the place where people with the most serious injuries get taken for treatment. I'm Celia Hack, a health reporter for Signal Cleveland. Trauma care has been in the news a lot lately. That's because the Cleveland Clinic is interested in opening another trauma center in the city. They say adding a trauma center will help the community, especially when it comes to having to transfer patients between hospitals. The county's public hospital, Metro Health, already runs a trauma department. It says adding more trauma care would actually worsen patient outcomes. So now Metro Health is on a tear to inform community members about their perspective. Last Monday, they took members of City Council's Health Committee on a tour of its trauma department and held a meeting in their hospital. The first step was to head upstairs to the helipad. Injured patients who live farther away are usually taken to the hospital by helicopter, while closer folks are taken by ambulance. The inside of the helicopter is small, but it fits one pilot, 2 medical staff, and a patient. After a patient gets dropped off by ambulance or helicopter, they're taken to a room like this, which is called a trauma bay, to be assessed.
You guys heard us talk about the trauma bay. That's what this is. We have 6 that are essentially identical right here in this area. We have one that's specifically for pediatric patients, so it's a little cuter and it has all the pediatric equipment in it. But we have almost everything we need right here in this room.
If a patient needs surgery right away, they're brought upstairs.
You can bring the patients right up from the trauma bay and they can go right back into the operating room.
Then, if a patient needs to recover, they're brought up to a room in the ICU like this one. So what happens next? Will Cleveland City Council members weigh in on the trauma debate? Some state lawmakers already have, asking the clinic to pause their plans until they complete a needs assessment. Cleveland Clinic told us that they were going to present to City Council in September. In the meantime, several council members said they want to see conversations between the hospital systems.